Hey, it's Friday. It's TGIF Doc Talk with Dr. Go. Click the share button to share this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.
Hi everyone and welcome to another episode of Doc Talk, and today we'll be talking about dementia decisions. Who do you call when you face an elderly person with dementia? Now this is a very common question I get from family members, as most individuals would actually experience this for the first time in their lives, and very often it can be extremely overwhelming. And in this episode, we will explore the often confusing question of which medical professional do you turn to when an elderly loved one shows signs of severe dementia. Now, should you stick with the family doctor, your usual GP? Or should you get a specialist like a geriatrician involved? Or do you seek mental health support through a psychiatrist? And these are the very typical questions that I get. Now, before I deep dive into the answer and the topic of today's discussion, I'd like to just share a little bit about an introduction about dementia. Dementia is a disease where the brain degenerates. It just slowly goes smaller and degenerates, and it loses its brain function once a little bit at a time. It is a very complex, progressive disease with a relatively long time horizon. It could be years, it could be 2 years, 3 years, 5 years, 7 years. And there are many types of forms of dementia from how it is caused. And different types of dementia actually presents very differently. You may have some elderly folks who are quiet, some may be disruptive. They keep calling and calling and calling, and some may even be very paranoid or accusative of others, saying somebody keeps stealing their money, this person wants to poison them, this person wants to kill them, and even some may just have some very, very bizarre behaviors. And because of this very wide range of symptoms, there is really no one-size-fits-all solution or treatment for this condition. Now, when an elderly person starts to develop dementia, there are 3 lines of defense, I would say. The first line of defense is usually the General Practitioner, and this is usually the starting point when early symptoms presents itself. They are usually a very familiar face. Probably this elderly person has seen them for the past 20-30 years and has built a lot of trust with this person. So this actually presents as a very less threatening approach. Instead of telling your parent that, I'm going to bring you to see a psychiatrist, where they will start to think that, are you thinking that I'm going crazy? So bringing them to a GP for a very simple assessment, they will usually contact the GP beforehand just to prompt them of this situation. And the GP will usually do a very initial assessment, what we call a mini mental state examination, for a very simple and early diagnosis. And another role of the GP is basically to rule out other reasons that may be the cause of this elderly person starting to act in a bit of a weird way. So there are other causes aside from neurodegeneration, like it could be some infection, it could be certain medications, it could be some vitamin deficiencies, it could be many of these factors which are reversible. And once the GP is able to rule out all of these other causes, they will be able to refer to a subspecialty which they deem appropriate. Now, in most cases, GPs are typically able to start off with certain first-line treatment medications, but under most circumstances, unless of course this particular GP was previously trained in a psychiatric department for a few years, most GPs are usually not well equipped to handle very complex dementia cases in depth. Now that's where they will start to refer, and depending on the circumstances, they may either refer to a geriatrician or they might refer to a psychiatrist, depending what the situation is. Now that brings us to our second line of defense, which is the geriatrician. And a geriatrician is basically an aging specialist. They are specifically trained in elderly care, and they know how to handle patients aside from their other chronic diseases. They also are able to handle simple or moderate or even severe cases of dementia. And under most circumstances, the geriatrician would be able to start the first line, the second line, or even the third line treatment for handling relatively difficult dementia cases. And the good thing about this is that with the geriatrician, it's usually a one-stop center. So most elderly people, they will not only have dementia, they will have things like diabetes, high blood pressure, high cholesterol. Some might have coexisting Parkinson's disease. Some might be suffering from a stroke. So instead of seeing different subspecialties together, you have a one-stop center and all-in-one aging specialist to handle all of these cases. Now, when do they typically refer to the psychiatrist? The psychiatrist in the context of dementia, I would say it's something like the last line of defense. And usually there is a referral to the psychiatrist when the elderly person presents with symptoms of aggression. So there might be, attempts to hurt other people with a knife or a sharp item. If the elderly presents with multiple attempts of suicidal thoughts or even suicidal attempts, very severe paranoia, they are accusing their neighbors of trying to kill them to a point where they start to call the police and things like that. Some very, very bizarre, uninhibited behaviors or even hallucinations. And they could say that they suddenly saw Jesus, they saw their parents who passed away like 30 years ago. And this is actually the part where you really need to consider a psychiatrist, because this is their zone, the mind. Now, the medications, or I should say the goal of treatment of psychiatrists, is basically to normalize behavior, and their aim is to make life livable for the elderly within the circle of care by their carers, by their family and other relative or family members. And that is actually the main goal of the psychiatrist, to try their very best to normalize the behavior for this elderly person to be able to cohabitate with other elderly or even their carers or their family. And that's really the goal of this treatment. Of course, the treatments that psychiatrists will prescribe will often have certain trade-offs for these medications, and sometimes it may come at the expense of the elderly person's thoughts or what makes him or her who they are. And very often after starting on these medications, they will not be the same person anymore. They will probably be a much quieter person, but nonetheless it would be an approach which allows them to be able to live in a situation where the people around them will not just go crazy trying to live with them together due to all of the very bizarre behaviors. Now, I guess this is a very simple and short podcast, but I would just like to recap everything. That the take-home message here is that in the context of dementia, there's really no one-size-fits-all treatment. But it's very important that you need to bring these elderly person to the appropriate professionals that can help. And this will make a very big difference, and it will often be a very big relief to family members when the elderly person is treated well. So that's all for today, and thank you and good night. If you like this podcast, please do not forget to like, share, and follow us. Thank you.